Welcome back. This is Dr. Jin Sung, and today we're continuing on the topic of fatigue. Today's topic is hormone dysregulation and fatigue. So before I even get started, I would like for you guys to go ahead and like this video and like the page so you can get more updates on a weekly basis. And secondly, share with other people so they can get this information that can be quite valuable for you. And I also like for you guys to take advantage of the complimentary 10-minute phone consultation. I mean, where else can you talk to an expert in the field of functional medicine, functional neurology, and speak to them on the phone for 10 minutes about your specific condition. So I would like for you to take advantage of that, okay? So today we're going to talk about hormone dysregulation and fatigue. The number one cause for fatigue and hormones is really a thyroid condition. A thyroid condition called hypothyroid, where your thyroid, which is a gland right here, which is responsible for your metabolic rate. So there are many people who have under-functioning thyroids, and they are tired, and they're not sure why they're tired. The number one marker that you need to look at for thyroid is something called TSH, or thyroid stimulating hormone, right? So if you look at that marker, in the lab ranges, it's going to go anywhere from like 0.5 up to 4.5 or 5. If you fall outside of that range where it goes above 4.5 and 5, they will consider you hypothyroid or under-functioning thyroid. And then if they recheck you and the numbers are still high, they might put you on a medication called Synthroid, Levoxyl, levothyroxine. And this will help to get the TSH number back into a normal position or normal range. Okay? So hypothyroid is a big cause for fatigue. What people don't realize is that the medication may help temporarily, but oftentimes what I find is they have a condition called Hashimoto's thyroiditis. This is an autoimmune condition where your immune system recognizes your thyroid as a problem. So your immune system is dysregulated and it's attacking your thyroid, causing a hypothyroid state. So the number one cause is actually an autoimmune disease for Hashimoto's thyroiditis, right? So if you have a thyroid problem, you should always check for thyroid antibodies. It's called TPO and TGB antibodies. So you should always check those antibodies to see if you have an autoimmune condition, right? That can be easily done through blood work through your primary care physician. Now, if you show up positive for TPO and TGB antibodies, not only taking medications, but also thinking about immune regulation would be an important factor for recovery of health. So things like diet matter for those patients in hormone regulation, right? We're talking about hormone regulation and dietary changes. So the two main foods that I like patients to eliminate if you have a hypothyroid condition is gluten and dairy, followed by nightshades, lectins, and soy. Okay? If you can eliminate those foods, sometimes the autoimmune process can be calmed down. So those 5 food categories tend to be inflammatory for the GI tract. And your GI tract holds about 70 to 80% of the immune cells. So it's very important to eliminate food triggers that can create inflammation in the GI, which in turn will create immune dysregulation. So it's very important to have the necessary dietary changes to affect hormone dysregulation regarding thyroid. So hypothyroid is a big factor in terms of fatigue. So you should always have those markers checked. Okay? Number 2 is something called pregnenolone steal. So when we look at our hormone panel, your hormones or your sex hormones are really produced from cholesterol. So cholesterol is the mother hormone. cholesterol needs to be converted, and eventually will make pregnenolone. Pregnenolone will go one way and make cortisol, which is your stress hormone, and aldosterone. So your cholesterol is converted to pregnenolone and makes cortisol, okay, your stress hormones. And then the other pathway is pregnenolone will go into DHEA, right? And DHEA makes up your estrogens, your testosterones, right? Your sex hormones. So if we are under a lot of stress, it pulls it towards cortisol and it reduces it towards the sex hormones. So think about it. If we are under a lot of stress, the last thing we are thinking about is actually having sexual activity. And the reason is because it's pulling hormones towards cortisol rather than pulling hormones towards the sex hormones. So it's important that we have our adrenals in check, right? What affects adrenals? Well, anemia or low blood sugar, right? Anemia or low red blood cells, I'm sorry, right? So a poor oxygen carrying capacity can stress the adrenals. Poor sugar dysregulation or hypoglycemia or insulin resistance can affect cortisol levels, right? Sleep, stress, emotional, physical, all these things can affect the cortisol output. Where I find a lot of people fall apart in this area is when women who are under high amounts of stress, from one, having kids, two, having a busy life, maybe working and taking care of the home, or a single parent, right? They go in towards menopause. So as they get closer to menopause, what happens is, as the ovaries stop production of certain hormones, the adrenal glands need to pick up the slack. But if your adrenal glands are already fatigued and already worn out, and you go into menopause, it can be catastrophic for some women because it creates such a problem or deficiency in these hormones, right? Your ovaries will produce hormones until you hit menopause, and then it starts to reduce production or stop production. And your adrenal glands have to pick up the slack. And your adrenal glands do not have enough reserve. So having poor reserves going into menopause can be catastrophic for some women and creates significant amounts of fatigue for some people, okay? So those two main topics right there, Hashimoto's thyroiditis or thyroid conditions, and then pregnenolone steal or adrenal fatigue, are the two major things that we see in our office that cause fatigue. Now there are other factors, things like PCOS or polycystic ovarian syndrome, right? Where you have cystic growth in the ovaries and you have issues with testosterone, sugar dysregulation, and so forth. Those people can also be fatigued. Oftentimes they have irregular menstruation, and that's one of the first signs of someone having PCOS or polycystic ovarian syndrome. So you have to look at hormonal pathways as it relates to fatigue, right? So we went over a lot of different things, you know, anemia, blood sugar, liver function, gut function, and now we're talking about hormones. The important thing I'd like you to remember is that all of the things that cause fatigue are also interrelated, right? It's a big web, a web of physiological dysfunction, right? One thing affects the next thing. Like blood sugar affects cortisol, right? And cortisol affects blood sugar. So everything interconnects. So we have to be able to test these things and figure out what would be the proper intervention. It's not just, oh, we have a problem, let's just give them that, right? We have an adrenal problem, let's just give them adrenal support, right? What is the underlying physiology? If you still have remaining anemia or blood sugar dysregulation, it doesn't matter how many adrenal support you give a patient, they will not feel better, but they may feel slightly better, right? You have to be able to figure out the underlying physiology with the proper testing to figure this out. All right? My name is Dr. Jin Sung, where clinical excellence meets excellent results. Take my offer up and give me a call at 978-688-6999 for your complimentary 10-minute phone consult. Okay? Talk to Bonnie or Cheryl, and they can handle that for you. All right? Have a great day.